Meet Miriam. Miriam is a mother of 4 in Kalakora, Mali. Miriam's children face a condition called pneumonia. Pneumonia is a condition treatable by medication. However, traditions within the community prevent Miriam's children from getting help in time. Two key solvable issues here are education and accessibility, and these are challenges faced by mothers like Miriam.
Good morning, guys. So today my colleagues, Bailey, Ricardo, Jordan, Yihan, and I, Nene, represent the Canadian Red Cross. So before we start talking business, I want to start by giving you guys a quick overview of the company. The Canadian Red Cross, founded in 1896 by Dr. George Sterling Burson, is part of the largest humanitarian network in the world, the International Red Cross and the Red Crescent Movement, which is the equivalent of the Red Cross in Muslim countries. Initially, the organization got founded as a response to lack of medicine and help during the American Indian Wars. Afterwards, during the First World War, it established itself as the leading humanitarian aid organization. It grew so rapidly and had such a big impact that it got an expanded mandate from the federal government to continue to operate in times of peace. Our mission is to improve the situation of the most vulnerable in Canada and throughout the world. So when it comes to our international programs, we have 3 different programs: the Emergencies and Disaster Program, the International Development Program, and the Maternal Child Newborn Health Program. For the last one, the Maternal Child Newborn Health Program, it has reached more than 13 million direct beneficiaries in 24 countries across America, Asia, and Africa. Our previous programs were implemented in African countries such as Senegal, Liberia, Nigeria, and more. Our current programs are implemented in Mali and South Sudan. Now, why Africa? Almost half of the global under 5 deaths happen in Africa, mostly in sub-Saharan Africa. In addition, almost 99% of maternal deaths happen in developing countries, almost half of it in sub-Saharan Africa alone. So I will now pass it on to Bailey, who's going to give you a more detailed description of the problem that we're facing.
On the international sphere, the Canadian Red Cross focuses on 3 main initiatives, one being maternal, newborn, and child health. Every day, 18,000 children and 8,000 mothers die. Every day, 26,000 people die in ways easily preventable given improved access to healthcare and intervention. Here, at the Canadian Red Cross, we focus on bettering maternal health and mitigating the number of preventable child deaths under the age of 5. One of the leading causes of preventable deaths amongst mothers is unsafe abortion. In rural, underdeveloped communities around the world, women lack access to basic family planning resources and are forced to take extreme measures to try and take control of their bodies. The Canadian Red Cross provides access to contraceptives in the form of birth control and IUD to save millions of young women every year. The leading cause of death amongst children under the age of 5 includes pneumonia, diarrhea, and malaria. Pneumonia claims the lives of more children than any other bacterial infection, with over 3,000 children a day. Easily compatible with the right medication, pneumonia ravages the world's least fortunate. Every year, about 3.1 million children die from malnutrition. Malnutrition causes children to become more vulnerable, making them far more susceptible to diseases such as malaria, diarrhea, measles, and pneumonia. Here, at the Canadian Red Cross, we aim to provide underprivileged children with the nutrients and medications they need to thrive. The Canadian Red Cross has already established ourselves in rural communities all across South Sudan, where we bring medical care to more than 350,000 mothers and young children in remote locations in the form of mobile health units. We aim to strengthen the community by training mothers on the basics of breastfeeding, properly caring for their infants, and preparing for the postpartum period. In addition, nutrients and supplements and medications to fight malaria, diarrhea, and pneumonia are distributed at these centers. Our goal is to extend the reach of these services to cover more of the world's poorest and remote locations. We want to provide the world's poorest with the basic health care that we, as Canadians, take for granted.
We've been delivering community health in Canada and around the world since 1923. Our emergency health programming dates back even further. BUSA is committed to delivering science for better life by advancing a portfolio of innovative treatments. And women's health is one of the 6 key therapeutic areas Central Pharmaceuticals covers. And women's health is also what we are working hard on. Canada Red Cross focuses on reducing preventable death of children under the age of 5 and improving maternal health. We provide women with the knowledge and means to take control of their reproductive health needs before, during, and after pregnancy, to access health facilities for themselves and their children. Your mission is to contribute to the development of the less developed regions by increasing access to the health and nutrition. Your idea coincides with our approach. Our priority is to work in rural, remote regions of the world where health services are largely absent and emergencies, where health services have virtually collapsed. By following the suggestions of Bayer's life value, leadership, integrity, flexibility, and efficiency. In the past decade alone, our maternal, newborn, and child health program have reached more than 13 million direct beneficiaries in 24 countries across America, Africa, and Asia, which shows our leadership as well as efficiency. For integrity, we are the member of Red Cross and Red Crescent movement, and women's health and improving preventable death of children is what United Nations Millennium Development Goals concern about. Women's health problems are one of the major challenges of our time. Supporting us aligns with your value and your aims, and with your help, we can achieve both of our goals together.
The strategic plan of this initiative wants to impact the long-term spectrum of maternal and infant health in African communities. Our goal really is to expand our efforts from the local villages in Mali and South Sudan toward local communities in Chad. From the planning of the pregnancy, during the pregnancy, and up to the early lives of the infant, we want to have a long-lasting and deep impact in the health of these communities. To fulfill this purpose, firstly, we want to provide contraceptive methods to women and mothers and future mothers in these communities in the forms of IUDs and contraceptive pills to limit unwanted pregnancies, as well as to limit the negative and even fatal effects of poorly executed abortions. Secondly, we want to ensure the health of the mother and the baby by providing them with regular doses of prenatal vitamins. And thirdly, we want to ensure the safe execution of the childbirth by giving them access to treatment that limits the effect of postpartum hemorrhage. Fourthly, we want to ensure the baby's health by giving mothers access to life-saving medication as well as multivitamins that fight pneumonia and malnutrition in these communities, which happen to be the top two problems that increase infant mortality. Lastly, we want to ensure the cultural relevance of this initiative as well as its impact by co-creating educational workshops with their national Ministry of Health as well as with local community leaders to ensure that the knowledge, this medical knowledge, gets passed on and remains culturally sensitive to these communities.
In terms of branding, the Canadian Red Cross is reputable and widely supported, with 13 million beneficiaries across the world. We're also known for our long-term commitment in supporting the solutions that we implement. For this particular initiative, we intend for Bayer to be the sole contributor. This will allow us to market the partnership similar to the way Dawn does in dealing with the oil spills. They use their product, which is liquid detergent, in helping the animals impacted by the oil spills. By showing Bayer's products in a real-life application that contributes towards the greater good, will only strengthen the brand image of the company. For this particular initiative, we're looking at a long-term women's health project, which will show Bayer's commitment to long-term and sustained progress. Currently, the Canadian Red Cross initiatives focused on long-term objectives aim to achieve three different things. The first is access to life-saving treatments. The second is strengthen communities. And third, strengthen ministries of health through skills and technical training, which we'll discuss later. Additionally, our initiative contributes to the United Nations Millennium Development Goals, which provides another reputable link for the project. Ultimately, the benefit of partnering with the Canadian Red Cross is twofold. It provides Bayer a strong link to a reputable name in the Canadian Red Cross and allows for Bayer to demonstrate the quantifiable outcomes of their products in a real-world application.
On behalf of the Canadian Red Cross, we are asking Bayer for medication so we can expand our services into Chad. After South Sudan, where we are already present, Chad has the highest maternal mortality rate in the world at 1,140 deaths per 100,000 live births. In addition, though steadily decreasing throughout the years, Chad has the 5th highest infant mortality rate in the world with an alarming 71.4 children per 1,000 live births.
Follow our strategic plan. The Canadian Red Cross would like to partner with Bayer to donate medication to our shared cause. One of the main focal group we would like to address is pregnant women. Elevant, a leading prenatal vitamin by Bayer, can provide expecting mother with vitamin C need to sustain a healthy pregnancy. The vitamin will help to support the baby's development and help the mother to meet their nutritional needs before, during, and after pregnancy.
As a leader in women's health, Bayer has access to a wide variety of contraceptives, such as birth control pills and IUDs that can help women gain control over their lives and lower one of the highest causes of deaths among mothers, which are unsafe abortions. Moreover, we would like access to your postpartum hemorrhage expertise. The second target audience of our program are children and infants. And we would like to ask for your wide plethora of pneumonia combating drugs such as Avelox and Cipro. In addition to all this, we would also like to ask you to help us provide access to multi-nutrients, such as your iconic Flintstones gummies, to help combat malnutrition among these children.
Furthermore, we're asking for volunteers to implement an education program on maternal and children's health. These workshops will aim to provide health education not only to individuals within the community, but also to the Ministry of Health staff in terms of technical and management training. This is in order to promote the long-term sustainability of reduced infant mortality rates. Our goal would be to introduce the volunteers to CHAD in order to train health official workers, which would then support the community by hosting the workshops. This is in order to make women feel as comfortable as possible. Thank you for your time and consideration. With your help, we can help support mothers like Marianne in building happy, healthy families in order to achieve science for a better life.